Hi, everyone. My name is Colin, and I have the privilege of being part of the legal team at MRG.
Hi, my name is Eunice Olembo, African Legal Officer with Minority Rights Group International based in Kampala.
I'm Ifra. I work primarily on the South Asia programs at MRG.
Hi, my name is Laya and I work at Minority Rights Group International at the fundraising department.
Hi, I'm Miriam and I run MRG's programs in Iraq and Iran.
Hi, I'm Anna. In MRG, I run Media, Minorities and Migration program that builds bridges between journalists and refugees in the camps on the borders of European Union.
Hi, I'm Joyfree. In MRG, I'm coordinating a project aimed at strengthening the capacity of minority and indigenous communities to demand for enjoyment of their health and education rights in Kenya and Ethiopia.
I always heard a lot of personal stories of people being stuck in one place and not being able to meet with their beloved ones.
In these COVID-19 times, children have been out of school for at least 4 weeks. However, for refugees and other forced migrants, this has been their constant yet very unfortunate reality.
COVID-19 is having a devastating impact on South Asia and across countries that are ill-equipped to handle a pandemic of this scale.
In the COVID-19 times, already after 3 weeks, I miss my family and friends so much. What if it takes 3 months? What if it takes 3 years?
Now just imagine never having access to a hospital for your entire life because you are undocumented or because the community where you live lacks basic healthcare infrastructure.
Some of our community partners walk over 40 kilometers to reach the nearest health facility. After overcoming great challenges, including dodging landmines, which are planted by terrorists, they find that the facilities do not have essential medicine.
In Pakistan, daily wage laborers are out of work and facing starvation, and they say they'll either die of hunger or they die of this virus.
In my home country of the United States, for example, Black and brown communities are clearly on the front lines of fighting this pandemic, but they're also being disproportionately impacted in the sense that they are being infected, hospitalized, and are dying at higher rates.
Around the world, we are being asked to practice social distancing due to the outbreak of COVID-19. I wonder what social distancing means when you are living in an overcrowded IDP camp with 7 members of your family under the same tent.
Refugee camps in Bangladesh, which were already struggling with basic sanitation and toilet facilities, they're bracing themselves for an inevitable tidal wave.
COVID-19 has created stigma, lockdowns, and curfews, as well as police brutality. Many countries are staring at possible hunger, unemployment, and economic recession.
Now imagine you are sick of coronavirus and you are treated differently or have no access to help whatsoever because of the stigma that is attached to your ethnic or cultural identity. This is happening as I'm speaking right now.
And in Sri Lanka, Muslims are being blamed for the spread of this virus, and this is fueling more mistrust and more hate.
These COVID-19 times force us to introspect and has brought to the forefront the ever-increasing need for us to ensure that no one is left behind, but also the need for us to ensure that we're building empathy and sympathy for the minorities in our community.
So while the virus itself may not discriminate, structural racism that has created healthcare disparities and socioeconomic inequalities has put these communities in a quite vulnerable position.
We stand in solidarity with minorities and indigenous peoples around the world during this pandemic, as always, and will continue to oppose discrimination in access to healthcare and all other human rights.
And in front of this, we say that no one should be left behind.